If you are a woman over 60, I want you to really hear this. Have you ever spent 20 minutes trying to reach orgasm, watching the clock, feeling frustrated, and finally giving up, feeling like you failed at something, like your body let you down again? I want to tell you something today. It might change how you experience intimacy for the rest of your life. The orgasm is not the point. It never was. And the research behind this is stronger than you think. Today, I will explain why chasing that one outcome every single time can actually work against your pleasure, and what to focus on instead. I am Dr. William Harrison. I have specialized in women's intimate health after menopause for over 20 years. Let me say this clearly first. I have watched this one misunderstanding cause more quiet pain in my patients than almost any physical symptom I treat. There is nothing wrong with you if orgasm does not happen every time, or even most of the time. What you were taught to expect, from movies, from casual talk, from a culture obsessed with one finish line, is simply not how pleasure works for most women, especially after 60. Think about where that expectation even came from. Almost everything we learn about intimacy comes from entertainment, not from real bodies, not from real science. Those stories compress everything into a few tidy minutes with a guaranteed result. Most women absorb that as the standard. Then they spend decades measuring their real experiences against a fantasy that was never true to begin with. If you have ever felt that quiet sting of failure after intimacy did not end in orgasm, write, "I needed this" in the comments. I promise you, this is one of the most common experiences among women your age. You are far from alone. And if you want honest, judgment-free talks like this every week, subscribe now. Let me tell you about Joan. Joan is 68. When she came to see me, she told me something that broke my heart a little. She had started avoiding intimacy altogether, not because she did not want closeness, but because, in her words, "I feel like I'm disappointing myself in him every time it doesn't happen." Without realizing it, she had turned something meant for comfort into a test she could fail. Joan was not unusual. She was, frankly, typical. Married for over 40 years. A good, loving relationship. No history of trauma, no relationship conflict, nothing dramatic. Just decades of quietly grading herself after every intimate moment, and decades of those grades slowly chipping away at something that used to feel easy and natural. By the time she sat in my office, she had nearly stopped initiating intimacy at all, simply to avoid the disappointment she had come to expect. We talked through what those moments actually felt like. Separate from whether orgasm happened, she described warmth, closeness, relaxation, real physical enjoyment. All of it she had been mentally throwing away, because it did not end the way she thought it was supposed to. A few weeks after shifting her mindset, not her technique, just her mindset, she told me intimacy felt good again, for the first time in over a year, no matter how each moment ended. Now, let's talk about the science, because this is not just a nice idea. It is physiology. Researchers have a name for what happens when you mentally step outside your own experience to judge how you are doing. They call it spectatoring. You stop being present in your body. You start watching yourself from the outside instead. You might recognize this feeling even outside of intimacy. It is the same thing that happens when you are giving a speech and suddenly become aware of your own voice, your own hands, your own breathing, and the moment you become aware of it, it all feels stiff and unnatural. The body that moved easily a second ago suddenly feels watched, judged, and clumsy. Intimacy works the same way. The instant you start watching yourself instead of simply being in the experience, your body responds to that self-judgment as a kind of threat, not as safety. Here is the problem. Spectatoring triggers the same stress response as any kind of pressure or judgment, and stress hormones directly block the blood flow and relaxation that arousal needs. So the very act of anxiously tracking whether you will orgasm makes orgasm less likely. You are not failing to relax because you cannot reach orgasm. Often, you cannot reach orgasm because you cannot relax. And the pressure to finish is exactly what is blocking that relaxation. There is a second piece almost nobody explains. After menopause, arousal simply takes longer to build. Often 10 to 20 more minutes than it did in your 30s or 40s. This comes from the same blood flow and nerve changes we have discussed in other videos. When your body does not move at the old, familiar pace, disappointment creeps in early, often right before your body would have actually gotten there. Many women stop right at that point, convinced nothing is happening. The expectation ends the experience, not the body. Here is a simple way to picture it. Imagine waiting for water to boil. If you expect it in 2 minutes and it actually takes 12, you might give up at minute 5, convinced the stove is broken. Nothing was wrong with the stove. You simply did not know how long the real process actually takes. Your body after 60 is the same. It is not broken. It just runs on a different clock than it used to, and almost nobody tells you what that new clock actually looks like. So let's redefine what we are actually working toward. Pleasure is not one switch, on or off. Think of it as a wide spectrum. Warmth, relaxation, closeness, sensation, comfort. All of these are real points on that spectrum. Orgasm is simply one point, near the far end. Not the only one worth having. A meal does not need the richest dessert to be a good meal. Every course along the way still counted. Pleasure works the same way. Treating everything except that final point as a failure quietly steals most of the experience from you. Joan said something I have shared with many patients since. I used to leave intimate moments feeling like I came home from a trip and forgot to take any pictures. Like nothing happened, just because I didn't bring back the one souvenir I thought I needed. Now I remember the warmth, the laughing, the closeness, because I'm not so busy waiting for something else that I miss what's actually happening. That shift from waiting to noticing is the heart of everything we are talking about today. Here are 4 practical shifts I walk my patients through. Shift 1. Remove the clock, mentally and literally. Time tracking is one of the biggest triggers for spectatoring. The moment you start watching the clock, you have already stepped outside your own body. Turn the clock face away. Put your phone in another room. Small changes, big difference. Shift 2. Redirect your attention to sensation, not outcome. Every few minutes, simply ask yourself, what does this feel like right now? Not, is this working? It sounds small. It changes everything about where your mind sits. Try noticing one specific sensation each time you ask. Warmth somewhere. Pressure somewhere. Breath. Anything real in this exact moment. Shift 3. Pay close attention to this one. It is the shift that creates the biggest change for most of my patients, often within a few tries. Decide before you even begin that today is already enough, no matter how it ends. This sounds almost too simple, but deciding the outcome in advance removes the entire emotional structure behind disappointment. You cannot fail at something you already called complete. Many patients say this single shift is what finally let them relax enough to let arousal build naturally. Sometimes that leads to orgasm, specifically because they stopped chasing it. Sometimes it simply leads to a genuinely good, closeness-filled experience that needed nothing more added to feel worthwhile. Shift 4. Talk to your partner about this if you have one. Partners often carry the same pressure, quietly worrying they failed you if orgasm does not happen. That adds their anxiety into the room, right alongside yours. A simple sentence can remove that weight from both of you. Something like, I want you to know this isn't about reaching one finish line for me. I just want us to enjoy being close. That alone often improves the actual experience for both people, just by lifting the pressure off the room. You might be surprised how relieved he feels to hear it too. I want to be clear about one thing. I am not telling you orgasm does not matter, or that you should stop wanting it. If you want to experience it more often, that is a completely valid goal. There are real, physical ways to support that, and I have covered several in other videos on this channel. What I am saying is this: making orgasm the only acceptable outcome of every encounter creates exactly the pressure that makes it less likely, while also costing you the real pleasure available in everything that led up to it. Wanting something and requiring it are not the same. Letting go of the requirement is often what makes reaching the goal more possible in the first place. Let me give you one more piece of the picture because I think it matters. Many women tell me they worry that letting go of the goal means settling for less. I understand that fear, but think about it this way. Right now, you already have a strict pass-or-fail rule, and that rule is not even working. It is not bringing you more orgasms. It is just bringing you more disappointment. So you are not trading a working system for an uncertain one. You are trading a broken system for one that actually has a chance to work. That distinction matters. It is not lowering your standards. It is removing the one obstacle standing in the way of meeting them. I also want you to notice something about Joan's story. Nothing about her body changed before things got better. No new product. No new treatment. Just a new way of paying attention. That is worth sitting with for a moment. So much of what we assume is a physical problem after 60 is actually a mental pattern we picked up decades earlier and never questioned. Questioning it costs nothing, and for many women, it changes everything. Here is a realistic timeline. In your first 1 or 2 tries with this new mindset, you will likely notice less anxiety right away, simply from dropping the clock and the pass-or-fail frame, even before anything physically changes. By your 3rd or 4th try, many women start truly noticing and enjoying sensations they used to rush past entirely. And interestingly, by 4 to 6 weeks, many of my patients report orgasm becoming more frequent, not less, because the anxiety-blocking arousal has finally left the room. I want to be honest with you about something. Not every woman who tries this reports orgasm becoming more frequent. Some simply report feeling more present, more relaxed, and more genuinely connected during intimacy, with no real change in how often orgasm occurs at all. I consider that an equally successful outcome. The goal was never to manufacture more orgasms through a mental trick. The goal was to remove a source of suffering that was never serving you in the first place. Whatever changes physically after that is simply a bonus, not the actual measure of success. Here is what I want you to try this week. First, before your next private moment, decide in advance that it is already enough, no matter how it ends. Notice how that decision changes how you feel going in. Second, remove the clock from the room completely. Third, practice asking yourself, what does this feel like right now, anytime your mind drifts toward judging instead of feeling. Fourth, if you have a partner, have that short conversation about lifting finish line pressure off both of you. One more question I hear often: does this mean I should stop caring about orgasm altogether? Not at all. Wanting pleasure fully is completely natural. The difference is between wanting something and requiring it as the only proof that an experience mattered. You can hope for it, even actively support the physical conditions that make it more likely, while letting go of the rigid demand that anything less is a failure. Wanting and requiring feel similar on the surface, but they create 2 completely different internal experiences. Learning to tell them apart may be one of the most freeing shifts you make at any age, especially now. If this gave you permission to let go of something you didn't know you were carrying, share it with a friend. So many women quietly measure their intimacy against a standard that was never fair to begin with. A short, honest conversation can dissolve years of silent self-criticism almost instantly. You might be the reason a friend finally stops grading herself after decades of doing it without ever questioning why. Leave a comment telling me which of the 4 shifts felt most relevant to you, and subscribe to this channel, because every week I share honest, medically grounded talks like this one for women navigating intimacy after 60. I will leave you with this. Pleasure was never meant to be a test you pass or fail. It was meant to be felt, fully, in whatever shape it takes on any given day. The moment you stop demanding one specific outcome from your body, you often discover there was far more pleasure there all along. You just were not giving yourself credit for noticing it. I am Dr. William Harrison. I will see you in the next video.